Welcome back. Mental health experts worry about the effects COVID-19 could have on people's mental health. The World Health Organization has called the issue extremely concerning. National surveys conducted this year show that nearly half, 45% of people in the United States have reported distress during the coronavirus pandemic.
4 suicides over the course of a week on Kauai is raising concerns over how the pandemic is affecting mental health right here in Hawaii.
Joining us live now with more is State Representative John Mizuno. Representative, thank you so much for joining us.
Thank you for having me.
So, in your opinion, is this pandemic causing an uptick in suicides here in Hawaii?
Yes, here and around the country, stated a rise in suicides because of COVID-19 pandemic. With a lot of people that are isolated and cut off from their normal support systems, with loss of jobs, the inability to pay for bills, rent, mortgage, possible evictions, all these things adding up put people at a higher risk for suicide.
John, I don't know if you know the answer. We've reached out to the Department of Health, reached out to those who may track the data, but amongst all the rest of what's happening with COVID-19, maybe it's getting lost. Do you know if the amount of people who are affected by suicide is climbing in Hawaii during this time?
I don't, because it's hard to just take a snapshot of right now. It's going to take another 6 months before we get the data in line with what's going on right now. That's why it's difficult.
What are the signs that we should be looking out for with our family or friends to help with people who are potentially considering suicide at this time?
Excellent question. Some of the signs are the person's talking about death, dying, or suicide, or posting some negative things on social media. They're really in a dark area, and that's pretty evident. Some of the other signs are not as apparent. You'll see mood swings, people getting angry or extremely sad or depressed. They're no longer hanging out with their family, friends, or coworkers, and they're a little more agitated. If you see that, what research has taught us is that it's important to be direct and ask them, hey, friend, are you good? You need some help? And if you do see the obvious signs, though, that's a clear indication to get them the professional help they need, because along with professional help, they have resources to help that person get out of that dark area that they're in.
Even before this pandemic, the rates here in Hawaii were higher than those across the nation. Where can people get help?
I've given KITV a list of resources and comments, so you can definitely get help from these lists.
To help prevent a potential increase in suicides right now and also after this pandemic passes?
Thank you for the question. The focus needs to be long-term and ongoing. It needs to focus on the mental health of our people. In addition, we need to focus on education, awareness, and prevention of suicide. This needs to be targeted at both public and private schools and workforce development or workplace development. If we can have that in our schools and our workplaces, then we should have a better handle on suicides in Hawaii. Finally, I did want to say that rural areas and neighbor islands, they have a lack of access to healthcare. So we really need to focus on funding for our neighbor islands and rural areas to ensure access to mental health services for people contemplating suicide. Finally, telehealth could be an option for people in those areas. So we're hopeful that we can do a better job in addressing suicides in Hawaii.
State Representative John Mizuno, we thank you for your time.
Thank you for having me. Appreciate it.
And like the representative just said, here is a list on your screen. If you're experiencing thoughts of suicide, struggling with mental health, or know someone who is, a number of resources out there. You can see some of them on your screen. You can call the National Suicide Prevention Lifeline of the Crisis Line of Hawaii to speak to someone about how to get help. There's also a crisis text line. Just text Aloha to 741-741.
Many parents